That's what I'm asking. So even if the children can go, then we go to go. Of my daughter plans of the hospital.
I don't know. No. So, okay, Shedrack, very sorry for the delay. Very sorry for the delay. We are experiencing a lot of difficulty, but then we are on now. All right, so we are on. All right, so good evening, everyone. We are very sorry for the delay. It's because of some unforeseen circumstances and all, but we're here now. We're live now. So before we continue, we would like you to go down to the comments before the comment section, just below this video, and subscribe to our channel so that you'll be notified anytime we come up with our videos. You get notifications for our video uploads and our live streamings. This evening, as we earlier said, we are going to be having Dr. Shedrack Osuji. I was thinking this will happen. Dr. Shedrack Osuji, and we are going to be talking about everything HIV/AIDS. Everything HIV/AIDS. So last week, Wednesday, was World AIDS Day. And of course, when we're talking about pandemics, there are some of the pandemics that really put in so much of scare in people's mind, and HIV/AIDS is one of them. And this evening, in our interaction with Dr. Shedrack will be making some of these things that looks mysterious about HIV/AIDS much more clearer to us, the non-medical minds. So, Dr. Shedrack, good evening and welcome. How is Abuja this evening? I think you are mute. Can you unmute yourself, Dr. Shedrack?
Oh, hi. Good evening, everyone. Thank you for having me. Abuja is fine.
Thank you very much, Dr. Shedrack. So, Dr. Shedrack, if on a starting note, for someone, a layman like us, or for laymen like us, how would you want to explain the whole HIV/AIDS scenario? What would you say about HIV/AIDS?
Okay, so HIV basically is a sexually transmitted disease that causes our immune system to, attacks our immune system basically. So that's the T cells, and then the CD4 cells and T cells. Yeah, so it causes it decreases our immunity, and then causes opportunistic infections. So basically, that's what HIV is actually. So note one, sexually transmitted disease that attacks our immune system and then gives room for opportunistic infections.
Okay, you said something about opportunistic infections. Can you make it a bit clearer for us?
Okay, so there are certain infections that usually would not come to us, but then because our immune system is decreased, like our immunity is low due to the HIV affecting our immune system, we would see certain infections rise up. So infections like toxoplasmosis. I'm trying not to speak a lot of medical jargons here today.
Yeah.
So infections like toxoplasmosis and what's it called? And then some other infections that can cause pneumonia. Generally, just know that these are infections really that can come up because our immunity is low.
Okay, so how can this disease be contracted? Because there are so many, should I put it, conspiracy theories out there, people saying one thing or the other and everything. So can we get in clear terms how one can contract this disease?
Okay, so the World Health Organization places HIV under sexually transmitted disease. So that means you can get it through having sexual intercourse, basically. Also, okay, but not just that, basically. So generally, the overview is that you can get it through bodily fluids. So if you have vaginal sex, if you have anal sex, you could contract HIV. Also, if you are transfused blood, like infected blood with HIV too, you can get it. If you share sharp objects that is infected with HIV, you can also get HIV. So yeah, that's the main route through which an HIV can be gotten.
Okay, I have a question, and there's something that came up in my mind when you were talking. First of all, from what you said earlier, you said it opens way to opportunistic infections, if I'm correct.
Yes,
that means that HIV itself is not the issue. Rather, it's more like a gateway for other infections to come in. That means there should be a problem with knowing the symptoms, because there won't be definite symptoms for HIV/AIDS. Am I sure I'm correct?
So usually when someone contracts HIV, after a few weeks, the person would develop flu-like symptoms. So that's non-specific symptoms. Basically, it could be joint pains, it could be headaches, it could be fever, it could be even cough and catarrh. So flu-like symptoms, basically. So the person might not know, because it's not specific. So the person might not know that this is HIV really, and then after that it goes asymptomatic. Really, the person does not have any other problems, and then until it starts attacking our immune system, our CD4 counts start going low, then we can now start seeing other symptoms. Maybe the person begins to fall ill more frequently than usual. So generally, HIV does not really have like a symptom that you can say, okay, this symptom is definitely HIV. No, it doesn't.
So when we're much more kids, there were things we do here. For example, you see someone who is lean, and the first thing that comes to your mind is, this person is suffering from AIDS. Is it like once the thing attacks you, or is it even true that someone who is suffering from AIDS, there are some pictures, some kid books that you see someone that looks like a skeleton, and of course, you start hearing something, you start the right that the person is suffering from HIV. Is it like, is immediately, or this doesn't even happen at all, or this is just like a stereotype that isn't even supposed to come up at all?
So HIV is like a progressive disease. So what it means is that after the first time I tell you that, I say, flu-like symptoms, and then after some time it's asymptomatic. Really, after some few years, if the person does not detect the HIV and then start treating HIV, what happens is that HIV becomes AIDS, acquired immune deficiency syndrome. Sorry. So now the problem is that when it's AIDS usually it's characterized by either when you have less than 200 of CD4 count, or when you have an AIDS defining what's it called, disease. So an AIDS defining disease is the opportunistic infection I've told you. Also, usually when someone progresses to AIDS, yes, the person can get that thing like we see in pictures. That it's called wasting actually. So the person will have symptoms of wasting, maybe due to chronic diarrhea. So the person will keep on going to the toilet. It's not like the person can have all the symptoms. He can have some. So you can even see someone who has AIDS and then it's not as thin as we used to think. But also, when someone is wasting really quickly, one of our suspicions should be HIV/AIDS actually.
Okay.
Yeah.
All right. So is there anything that is going on? Because I think the first time I heard this HIV something is maybe some 20 years back. No, not 20 years. Yeah, 20 years back. That was when I started hearing of. We are old men now. So I started hearing about HIV/AIDS some 20 years plus, and till now, I really can't say there is anything much being done about it in the world of health. Talking about cure, talking about preventive vaccines and all. So, is there anything that is going on in the world of health that you might tell us about this HIV/AIDS?
Okay,
concerning,
So HIV is 62 years old actually. It was it was first found in a Congolese man in 1959, if I'm getting it correctly. Yes, so 1959. So it's like 62 years old. Yes. So, like you said, really, it's a pandemic, and we all understand that it's a pandemic. Really, it's something that has been happening for years, and then has affected millions and millions of people. So, I personally believe that of course, there are like series of researches that are going on in concerning HIV actually. So I know that we first started from how there was no treatment at all for HIV. People would die from HIV, and now we are here where people live a long and satisfying life even with HIV. Now, I would highlight some of the breakthroughs we've had with HIV. So the first breakthrough that we've had is that first of all, we found drugs, antiviral drugs that could help reduce the viral load. So to reduce the viruses in the body, and then less virus means the person is healthier than before, basically. So, but there was problems because the drugs were a lot actually. So imagine taking 4, 5, maybe even 3, 4, 5 drugs a day, and you take it for the rest of your life. So it was a lot of drugs, and because of that, we had issues with adherence. People were not adhering to these drugs as they should, because and that made people still die from HIV/AIDS actually. So the next thing we moved on to is trying to find, okay, can we combine these drugs actually and make it one pill? So it's going to be easier to swallow, and then we're going to see increased adherence, and then increased health in people living with HIV/AIDS. So yes, so we found that you can take one pill. The pill contains basically 3 of the drugs you're supposed to take at once. You understand? So now it improves adherence. Also, some of the things that has happened in HIV is that we found a way to monitor HIV by knowing your viral load. Viral load simply means how much of the viruses are inside your bloodstream. And also we try to find out, okay, so your CD4 count, the higher it is, the better for you. And then your viral load, the lower it is, the better for you. Now, talking about viral load, one of the most amazing breakthroughs we've had really with HIV is that now there's something called U equals to U. That simply means undetectable equals to untransmittable. So what it means is that these drugs you are taking is capable of reducing your viral load down to undetectable. And then once your viral load is undetectable, it means that you can't transmit the virus to other people. So that means you can have unprotected sex, you can do everything you want to do, and you won't pass the virus to another person. So that was one of the breakthroughs we've had. And then the recent breakthrough, really, which I've been excited about since this week or since like last 2 weeks, it's in the UK now, we no longer the HIV patients no longer need to take 1 tablet per day, so they don't need to take 365 dosings again. They need to take they now have injections for HIV patients. So the people just have to take it once in 8 weeks. So now we've cut down the dosing of 365 times to 6 times a year. So definitely it will increase adherence, and it will increase also other things. Right now, also, we still have in clinical studies a lot of vaccines concerning HIV, and also a lot of vaccines, and then a lot of and also treatments concerning HIV. Some of them are in phase 2 clinical trials and all of that. So I really believe that soon HIV is going to be a forgotten pandemic, really, because the cure is already here.
So when we
Let's move on. Don't worry.
Okay, so when we had coronavirus, I think the speed that we got the vaccine, I was expecting similar speed something like that. But then it's something we're not seeing, and that's why we are a bit worried from over here. But then, sorry, Dr. Shedrack. So is there anything? Oh, anyway, you said something about it, so let me not just drag you back to it. I have a couple of questions here.
No, I understand. I'm sorry. There's some theories that says that because it's just a theory, really, that COVID affected the whole world, really. So that's why we had like a speed in vaccines creation and all of that. But then when it comes to HIV/AIDS, really, it's only at first it was really affecting minority groups, actually. So because it was minority groups, people were not so keen on trying to get vaccines and treatment for it.
Okay.
But then these are just theories, really. I know that some scientists have put in a lot of work concerning HIV/AIDS.
Okay. So because of the time, I would like to go straight to questions, and we had some questions that some of our viewers sent in. I will take a couple of them, just a few of them, and we'll save our time this evening. But before then, I have my own question. So my question is, why is it, of course, there are times people, ladies most especially, they experience violence, sexual violence, and they are exposed to things they wouldn't have allowed themselves on a normal day to be exposed to. So why is there anything that can be done for this set of people who probably they were raped, if I should use that word, and of course maybe the person that raped them is a positive person? Is there anything that can be done for this set of people to help them?
So that was the last breakthrough I was going to talk about. And then I was like, oh, let's just continue. So yeah, nowadays the protocol really, once you are you have some exposure to HIV, what happens is that, so whether through sexual violence or through occupational hazards, like whatever it is, actually, the protocol is that if you can find the person, or if we have the person who sexually assaulted the person, we check the person's HIV status and the person's hepatitis status to see if it's positive or not. So, but then when the person is absent, what we do usually is that we start the person on something called post-exposure prophylaxis. So post-exposure prophylaxis, this is it's like it's an antiviral drug, basically. So usually the person takes it within 72 weeks after within 72 hours after exposure. So for example, if the person was assaulted yesterday, between yesterday and 72 hours is like 3 days, yes. Within 3 days of the assault, the person should have started post exposure prophylaxis, and then so he takes that, and then the person keeps on taking it every day for 1 month. And then after that, so it's really effective, actually. The person can come out clean, and then come out and then test. Usually the person will test after that 1 month, and then also test after 3 months to just confirm that the person is HIV negative.
Okay. All right. I think that. But what if a person doesn't complete the dose, like misses maybe a day or 2 or 3? Does it affect the efficacy of the drug?
We all know that really for any drug reduction, you like truancy really in taking your drug could reduce efficacy. So yes, it could.
All right. So okay, let me just quickly go through some of the questions. The first person said something like, are there ways to prevent mother to unborn baby transmission of HIV/AIDS?
Yes. So now we have what's it called? We have ways really to prevent mother to child what's it called? Transmission. So one of the ways really is that we ensure that the mother really is on her antivirus while she's pregnant, actually. So that would help to reduce the viral load. Also, when the child is about to be born, we make sure that the child is born through cesarean section, because through vaginal delivery it could cause what's it called? It could cause, like, vaginal delivery increases the chances of the child contracting HIV, actually. Yeah. So and then there are other things put in place, but yes, it's possible, actually. And most times, if the person is HIV positive and then pregnant, there are special cares that will be done for the person in antenatal. So that's why it's very important the person attends antenatal care.
Yeah. Okay. All right. There is one other question. Okay, no, two more questions, please. Two more questions before we go down this, before we go off this evening. One question. The first one is, now there is another stereotype, or should I say it's another one of those conspiracy theories that Chibuike, and he stays in Owerri. He said there is at times when, of course, he involves himself in series of unprotected sex, and he feels that, okay, the best way I can do this is after I'm sleeping with whoever is that I'm sleeping with, I would go and take enough water and urinate. Doesn't it sound stupid? Or like, it feels okay, by urinating, the urine should flush the fluids that got into him during the whole action and all. So what do you have to say to Chibuike?
It's not scientifically proven that urinating after sex would reduce your chances of getting HIV. As a matter of fact, if he wants to have unprotected sex, he needs to start taking PrEP. That is pre-exposure prophylaxis. It's 1 pill per day. There are two ways to take it. You can take it if you are going to be having regular unprotected sex. You can take PrEP every single day of your life, and it has 90% efficiency rate, actually. And then also there's another one where you can take on demand between 2 to 24 hours before having sex. And then after that, you take it every day for 1 month.
What's the name of that one? That one's still is that one still post?
It's pre-exposure. Pre-exposure. Okay. So we have post-exposure and then we have pre-exposure. Now, another thing that is very important, adherence, really. The person needs to adhere to this thing for it to work, really. Yeah. So, but PrEP is efficient, really. Once the person starts it, and then, yes, the person can have unprotected sex. But note that PrEP does not stop you from having other STIs, other sexually transmitted infections, really. So you can be on PrEP and then it prevents HIV, but then you would still be able to contact syphilis and gonorrhea and all of the other STIs. So that's why, really, being with one partner or having protected sex is still top choice for preventing sexually transmitted diseases.
Sorry, Dr. Shedrack. So I also, what if someone have an AIDS patient, or say HIV patients around him or her, and we use the same knife, we use the same kitchen, we use the same sitting room, we eat from the same table, and we do almost everything together? Are my chances of contracting it increasing, or is there a way I can manage the person and I will still be my normal self?
Your chance of contracting HIV from someone you are eating with, someone you are playing with, someone you are living with, it's 0. Except you're having unprotected sex with this person.
Okay.
Now, it's 0, actually, and this is one of the stigma we need to really stop, because the reason why we're not reaching the goals the UN set for us, because right now we have 95 goals from the UN. The reason why we're not reaching that goal in Africa, one of the biggest reason, actually, is stigma with the HIV patients, actually. So people don't want to touch the patient. Stigma is everywhere, even in the hospital, actually. So some doctors don't want to touch the patient because, oh, HIV positive. So people hear that you're HIV positive, they don't, and people who are living with HIV don't want to live that kind of life. So it prevents them from getting tested. It prevents them from even standing boldly in the line to get their drugs because they don't want to be labeled as someone living with HIV. And then because the 95 goal simply means 95% of people living with HIV should be tested. And out of that 95%, 95% of them should be on antiretroviral therapy. And then 95% of them that are on antiretroviral therapy should be undetectable. The viral load should be undetectable. So, but we can't reach this goal if we have stigmas like that, actually.
Okay. And I was talking with my friend this evening, just like you said, he said something like people coming out to come and test. There are some people that will prefer to go down in their secret place and use what he called, my friend told me something about oral quick rapid tests. And I haven't really heard of it. Maybe he's used to doing stuff that should expose him to that, but then I haven't really heard of it. And the problem is this method reliable for testing HIV patients? Because they don't want to, maybe some say, I don't want to see blood. Why some others say, I don't want anybody to know I have HIV. I want to keep it to myself. So they go and buy these things and do it within their homes and everything. Is it reliable?
See, really, rapid test for HIV is not reliable. Both oral rapid test or even the one you have to put the blood is not really reliable, actually, because we can see false positive and we can see false negative. There's a huge margin for that. So it's important for everybody to test, not just with rapid test, to also test in the hospital. So because in the hospital, they usually confirm the test like twice, actually. So they do it the first time and then they confirm before they tell you. So most times, and there's a protocol for this, actually. So usually they start with the rapid test, and then if it's positive, they move up to ELISA. After ELISA, then move up to, sorry, I'm calling it a lot of tests, but then they move on to immunoblots or Western blots, actually. And then if the person is positive, then yes, they can say, okay, yeah, you're positive. So, but it's not reliable, really. I would advise anyone to really check their status in the hospital because it's important. Because even before you test yourself, there should be some sort of counseling, actually. Trying to explain to you that, because a lot of people who test themselves at home, what if you test yourself at home and you're positive? Suicide can happen, actually, because the person will think that this is the end of the world for him. So that's why it's important that you do your test in the hospital where we have counselors who will counsel you before you do any test. And then they will try to tell you that, see, HIV is not the end of the road. Even if you're positive or if you're negative, it's not the end of the road. So if you're positive, we still have like post-test counseling that will counsel you some more. And then if you are negative, they will try to advise you on what's it called? Safe sex and all of that.
So these drugs that you're talking of, talking about the post-exposure prophylaxis and the pre-exposure prophylaxis, are these drugs accessible, like easily accessible? Because
HIV is a place where there's money is heavily invested, actually. So that means these drugs should be readily available for anyone who wants it. HIV test is usually free. HIV drugs are usually free. Both the post-exposure prophylaxis, both the pre-exposure prophylaxis, and even HIV treatment itself is free.
Okay. All right. The final question for this evening, Dr. Shedrack, who do you think is at more risk of contracting HIV/AIDS? I mean, talking about males and females. And is there any reason if answers go either ways?
Okay, so scientifically speaking, it's said that really that the person receiving usually has a higher chance of getting HIV. So that means in case of heterosexual, I'm sorry, I have to say this actually, in case of heterosexual relationships, it's going to be the female, of course. And then if it's a homosexual relationship, it's going to be the person, what's it called?
Okay, the person receiving.
Exactly.
Yeah, okay. So that means the males. But is there any reason for this?
There are some scientific explanations that say things like it's because of the person has a wider area surface than the penis is just going to be like penis, and that's all. But then the person with the wider surface would have if it's a vagina, has the whole vagina, so there's a wider surface basically, and then surface area, and then same thing with if it's anal sex, the anus, it's a wider surface.
Sorry. All right. Thank you very much, Dr. Shedrack. And this is your cough. A doctor shouldn't be coughing. A doctor shouldn't be coughing. All right. Thank you, Dr. Shedrack, for being with us this evening and for trying to make so many things, stereotypes, and things that look so mysterious look so easy this evening. For any more questions, be sure that we're going to reach out to Dr. Shedrack to really put much more light on these questions as they come forth. Dr. Shedrack, thank you very much. And you have anything to say?
Yes, I have one last thing to say, really.
Okay.
So, guys, if you are watching me, please, like they say, HIV not the show for face. So please try to get tested, because the only way we can solve this HIV pandemic is if you get tested regularly. So try to get tested regularly. If you are positive, it's not the end of the world, really. Start your drug as soon as possible, and then do regular viral load. Really, within a short time, you will be undetectable, and then you will lead a normal life. HIV is not a death sentence. We're not in the 90s anymore. So yeah, really, thank you for having me.
All right, thank you so much, Dr. Shedrack, and do have a wonderful night. Thank you so much. So if you've not subscribed to our YouTube channel, this is the time you have to do this, because we'll be coming up with much more interesting videos, and we'll be coming up almost same time next time. Stay tuned and stay connected. This is Osuji Ebenezer Chukwuebuka. Thank you very much and good night. Thank you, Dr. Shedrack.